M42 was formed at the beginning of 2023 through the merging of Mubadala Health and G42 Healthcare. And M42 is committed to impactfully disrupt the traditional healthcare landscape in a sustainable manner utilising technology. So M42 has proudly been selected by the United Nations to be the principal health partner at COP28 this year. And again, this underpins M42's commitment to impactfully disrupt the healthcare landscape in a sustainable way utilising technology. Now we know health is on the agenda for COP this year for the first time in history, and this highlights the global crisis of climate change and its impact on health, human health. So within M42, we take a two-pronged approach. First and foremost, we look at prevention. So deploying technology to prevent people entering the system in the first place and becoming patients. Now, why is this important? We are currently on a climate health nexus. There are some fairly alarming statistics that I need to highlight. Number one, 13 million people die of health-related illnesses caused by climate change. Looking at the important topic of mental health, 68% of adults experience climate anxiety and depression. On the flip side, when looking at the carbon footprint of the healthcare industry, if we were a country, we'd be the 5th largest emitter in the world. Looking at hospitals, hospitals consume 2 to 3 times more energy than conventional systems. So fewer patients means fewer emissions. Secondly, we are proudly at M42 entering our net zero journey, and we have pledged to be net zero by 2050. So we're actively looking at our carbon footprint and using COP as an opportunity to form outcomes-based partnership to look for a low carbon future. Collaboration is at the heart of M42's endeavours. So we undertake research with leading entities. For example, the Abu Dhabi Department of Health. We've got an Emirati genomics program. We have an ambitious target to sequence 1 million Emirati genomes. We're currently at 500,000. So what does this mean? It means that we are able to, utilising technology, put in place preventative measures and more precise care. So again, avoiding people entering the system and becoming patients. And if they do enter the system, through our precision care, they are within the system for a shorter period of time. Secondly, looking at our planetary health. We are currently undertaking leading research with our collaborative partner, OceanX. So we have just finished a mission within the Gulf where we're doing environmental genomic sequencing. So through the gathering of large data, we're able to understand the health of the ocean ecosystem. Why is that important? Oceans are the largest carbon sinks on the planet and critical to solve the climate crisis. So within M42, we have a major presence within the Green Zone, excitedly within the Innovation Hub. And when participants come from diverse backgrounds from around the world, they learn something new. So they learn about the complex relationship between planet health and human health. Through that journey of discovery, they understand how technology can come to the stage and provide solutions. Solutions to address things like, for the first time in history, our children are going to have a worse of quality of life. So how can we switch that trajectory and use technology to understand more about human health, to understand more about planetary health, and to change this relationship so as to reduce our impacts on climate change.